everyone. Welcome to Policy for Normal People. I'm your host, Christy Amada. Policy for Normal People is a space I created about 6 months ago, and this is our final episode of 2025. So thank you so much for joining us just before the holidays. Policy for Normal People, if you have been listening, is a show to take out the politics and try to just talk in plain language about how policy may impact the lives of everyday Americans across the country, just like you and me. So I'm excited to welcome guest Joe Meyer today to the show. Joe is the CEO of Shelter House, and our topic today is homelessness. It's a much more complex topic than I think a lot of people realize when you start talking about policy and how that impacts the people that we're trying to serve, trying to help. And so Joe is going to walk us through some of that today. And Joe, I'm just so excited to have you on the show. Welcome.
Thanks, Christy. I'm looking forward to it.
Yeah, thank you so much. So, we're going to dive into a lot of stuff here today, Joe. I'll mention real quick for our audience, Joe's organization, the Shelter House, focuses on serving homeless clients in the Loudoun and Fairfax counties of Northern Virginia. I'm in Alexandria, so very, very, nearby here in Fairfax. But I think what we're going to talk about today, and I think Joe would agree, is this is relevant to everyone because you really can't go anywhere in America, sadly to say. And this is not a challenge that we're trying to solve. And we do believe that it is solvable, don't we, Joe?
Absolutely. Yes.
Yes, 100%. Yes. So tell us a little bit more, Joe, if you would, about your journey into, this type of service, and then a little bit more about Shelter House in particular and what they do.
Yeah. Christy, first, I really appreciate this opportunity, as we were talking before. Any opportunity that we have as Shelter House to get the word out about social issues around homelessness and domestic violence, and how domestic violence is a major contributor to homelessness, as is mental illness, as in lack of affordable housing. All of those things contribute to why people become homeless in the first place. So a little bit about me. I started my career over 25 years ago. I was born and raised in Western Pennsylvania and moved down here to the DC metro area to find a job. And all I knew is I wanted to help people. I knew that I was given some privilege the way that I grew up. 2-parent family, 3 brothers, middle class. I had everything that I needed given to me growing up. And I didn't realize that until I got older, that I could make a difference in people's lives. And that's really what I wanted to do moving down here. One, I moved down to this area because of the job market. Western Pennsylvania, small towns outside of Pittsburgh, not necessarily an area where I could have really built my career. So I had no idea anything about homelessness. I didn't know anything about domestic violence. I just wanted to kind of get my career started, and landed my first job at a homeless shelter in Western Virginia, and started working as a case manager, working directly with people who were experiencing homelessness. Mm-hmm. And here I am as a very young, fresh out of college, white kid in a very new neighborhood, and having no idea anything about what I'm doing. And I quickly found out that here are these grown adults walking into my office asking me for help. And it was a very eye-opening experience and a very humbling experience that they were coming to me for help, and they were coming to me for answers. And I say it was humbling, but it was also honoring that I was able to provide some help to them. So this work for me is really about making sure that we as an organization, we as people working for the organization, are able to provide resources and hope back to families who are falling on hard times. You mentioned about the issue of homelessness, and certainly homelessness is visible in certain parts of the country, in certain cities, inner cities. Mm-hmm. And what we're seeing here in the suburbs of Alexandria and Loudoun and Fairfax and Prince William, all over Northern Virginia, it's not necessarily the people that we see on the streets. It's the people that we don't see. And those are the individuals and families that we're seeing in our shelters. So I've been with Shelter House for over 20 years now, and have been really honored to be in this position for just over 10. We as an organization, we as a group of people working for this organization, have really been able to build a really solid foundation of making sure that we end homelessness for people who are experiencing it. Shelter House, we're just over 40 years old. We're almost 45 years old. And we started as a very, very small organization with one shelter. And when I joined Shelter House in 2005, that's all we had, one shelter and a few housing programs. And we reached out to the county, and we knew that at that time, just Fairfax County was looking for organizations to further the mission of ending homelessness, and opened up an additional family shelter in the Fairfax area. And we were awarded the contract. So to make a kind of a long story short, we started out as a very small organization, a very homegrown organization with great foundation, with great values. And over the 20 years that I've been here, we've been able to go from one shelter, and we're now operating 7 shelters across Northern Virginia. And that does include shelters for victims of domestic violence, shelters for families experiencing homelessness, and also shelters for individuals who are experiencing homelessness. We have over 200 employees that work for Shelter House right now. We work very, very closely with our local governments, who provides the contract to us to operate these facilities, but also housing programs. So Shelter House, when you see Shelter House, and you hear about Shelter House and the stories that we tell, it's a lot about the people who are staying in the shelters, the children who are staying in the shelters. When people volunteer for us, they come into the shelters, they provide meals, they do cleaning, they help kids with homework. But that's just one side of Shelter House. The other side of Shelter House is our entire community housing programs. And we serve just as many, if not more people in our housing programs than we do in the shelters. Our goal is not to bring people in the shelter. Our goal is to prevent people from coming into the shelter in the first place. And if we can't, get them out of the shelter as quickly as possible. And the only way that we can do that is by making sure that we have the adequate resources for what we call community or aftercare for families, so that they don't come back into shelter time after time after time. We're going to get into a little bit of that with policy and funding and everything.
Yeah, for sure.
But that's really the goal, is making sure when we're talking about ending homelessness, we don't believe that we'll never have another person experience homelessness in our community. That's not realistic. There are going to be things, there's going to be traumatic events in people's lives that cause homelessness. But what our job is, as a system, as a community, as providers, as governments, is to make sure that we do have that system in place so we can get people into housing as quickly as possible to end their homelessness, and then wrap the resources around them to prevent them from becoming homeless again.
Thank you, Joe, for that very thorough overview. And as you were talking, I'm thinking about, it really is true that the visible part of homelessness is such a small part. And unfortunately, there's a lot of stigma around that. And I will talk about that a little later in the show too. But the invisible part, there's so much complexity, right? I mean, there are multiple stages that you're trying to help people work through. And we'll get into that. We have a couple things in common. Southern PA is what I heard. So I'm from North Central West Virginia, and like you, I grew up in a modest income family, but certainly considered middle class for West Virginia. Probably wouldn't be for Northern Virginia. But there were so many kids that I rode the bus with growing up. I literally am one of those people talk about the hollows of West Virginia, but I grew up in Westerman Hollow Road, West Virginia. So we grew up in a very modest farmhouse with a lot of poverty around us. It's so important to, I think, understand the complexity of the entire challenge, so that we understand, what we need to do at every stage. And you're right, it takes the collective contributions and efforts of everybody, no matter what your job is or how you're serving society. It impacts everybody. Well, I'd like to kind of get into, sort of the policy part of our discussion. So let's kind of start local and sort of work our way up a little bit and talk about local policies affecting, in particular, shelter houses services, and your capacity to serve. Now, how do you feel that local policies affect services that you provide at Shelter House to people that are experiencing homelessness and domestic violence? You mentioned that domestic violence is a big piece of the effort to try to help people, because it unfortunately comes hand in hand with homelessness a lot of times. So how are local policies serving, helping, or maybe contributing a little bit of a barrier What are you seeing out there?
Yeah, so it's interesting. I believe our local politics and our local policies are actually more important than state level and federal level, because this is where the work's getting done. We
Mm-hmm.
certainly need the support of our local governments. Shelter House, the majority of our funding comes from contracts through the local government. So we work very, very closely with our local governments. And as you know, then local governments have policy. So it's very important that we have the support of them. So not only us as nonprofits, we can only do so much. We do fundraising,
Mm-hmm.
we have systems in place. However, if we don't have the coordination at the county level that is setting the policies of how these systems work, we're all going to be doing things differently. Therefore, we're not going to be very effective.
Mm-hmm.
Also, federal policies around making sure that we have a very tight, I keep bringing up systems, but very tight system around helping people. We do get federal funding. So when federal funding comes down, they want to make sure that we are not duplicating services. Is that they're not giving shelter house funds to serve this person and also another nonprofit or faith-based group these funds to serve the exact same person at the same time. So we have to make sure that we have policy in place to make sure our systems are very tight, to make sure that we are not necessarily, or that we're doing everything that we can for the betterment of the people, but also the community, and being good stewards of the resources that are being brought down to us in order to provide the services. So policy, it's then we get into more of the housing policies also, of making sure that we are breaking down barriers for people who are experiencing homelessness to actually get into housing. So fair housing laws, which are federal laws, we making sure that we are following those and that landlords are following those, right? Because there's enough challenges already for people to obtain housing when they are very low income, or when they have a poor work history, or maybe they have a criminal history. All of those things are barriers to get back into housing. However, it doesn't mean that we should create more barriers that they have to overcome in order to get into housing. They may have bad credit, so all of those things are already barriers. So let's put things into place that are going to help people get housed, help people to get more employment, better employment, so that they can, eventually pay rent on their own. So funding, I talked about that a little bit earlier. Policies around funding, local governments, the amount of resources that they're putting into social services within their jurisdictions is extremely important too. Some jurisdictions don't want to deal with the homeless population, so maybe there aren't as much resources for them because they believe that if they pour more resources into them, it's the build it, they will come type of mentality. Others, other jurisdictions pour money into social services to make sure that their community is somewhere where people can thrive. And that's what we're faced with kind of all over the nation right now, not just in Northern Virginia, but all over the nation, are the amount of resources that each jurisdiction has in order to solve this problem.
Wow. I'm just listening to you and I'm thinking about the sort of push and pull factors that your organization and others like you have to deal with every day. It's one thing to have funding. It's another to have maybe donors supporting you. All of those things are important, but the systematic push and pull factors. I mean, if you mentioned something that stuck out to me too, among many things, you said that I think I heard you correctly when you said that you got most of your funding locally. And I think that that's a really important thing to emphasize, because there is, and I like you do probably too, I follow the national politics a lot as much as I do, the local and state. And I think unfortunately people sometimes follow the national a little too much, because to your point, local is where the impact happens first. That's where you feel it first. And yet there's this unfortunate perception out there right now, some negativity circulating around. I did a podcast not long ago with someone who focused on nonprofit governance, and they're a consultant working with nonprofit board of directors. And there was a lot of reaction to the podcast about nonprofits are corrupt and this sort of thing. Well, there's a lot of attention on corporate nonprofits, corporations that are setting up huge nonprofits. And there has been, some issues found with those. But I think people need to remember that your local nonprofits are the ones who are out and about in your community making a difference in ways that are invisible, that you don't even see, for those like your clients who are experiencing homelessness, or who are maybe transitioning out of it. Churches and just food banks and so many other things, and all of these things work together to try to help what you're trying to solve, as well as other issues. So I'm really glad that you shared that with us. It sheds a light on the understanding of, there's a lot of focus on federal funding cuts and things like that. And I know when a cut happens one place, or an increase for that matter, I'm sure it makes your strategies have to shift with what you do. So I'm sure it's a daily jumping through those hoops.
Yeah, it is. And, as I mentioned, as far as the grants and contracts that we receive, some of the contracts are long-term contracts, 3 to 9 years. Other grants are year to year.
Yeah,
So
that's
as
pretty common.
right. So, a lot, and not just foundation grants, but, talking about state, local, and federal grants that we get, we have to reapply for every single year. And it just depends on the federal budget, depends on the administration, on what the focus is. So these are things, and, Christy brought up a great point of how we have to pivot all the time. We
Mm-hmm.
are constantly keeping an eye on the decision makers, the policies that are in place, what's going to be, the main focus this year. As you know, especially at the local level, but it's all because of trickle down is, budgets are tight right now.
Right.
For all of these funding streams that we receive funding for, they are very, very tight, and everyone's cutting here and there, and it's about keeping an eye on and advocating for, which is a big part of what we do. Also, it's not just a service delivery to the people who are coming to us, but we have to make sure that we're building relationships out in the community, and that we're building relationships with the decision makers at all the levels, because we have to make sure that we are sharing the stories of the people that we are helping and the impact that we are having, because we are housing a tremendous amount of people every single year that come through our doors, getting them back out on their feet. And without these safety net services, none of that would be able to happen. Not
Are you
without.
seeing an increase in the amount of people that you're serving? I don't know what range I would use, but let's say within the last 2 to 3 years, maybe.
Yes. So there's an annual, what they call annual point in time, which is a
Okay.
HUD required process. And it's done every January, and it's just one night. It's a point in time, actually. And it's
Mm-hmm.
every jurisdiction that receives federal HUD funding has to do this count on this exact day. And there's a whole process in place to do it. And we have seen an increase over the region of people experiencing homelessness on that one night. And it's always in January that we do the count. But not only that, I bring that up just to say that, if anyone wants to do research as far as increase in homelessness or anything like that, that's generally the count that we as a homeless service system, as a nation, that we go by. However, the important number that I feel like is how many people we're seeing over the course of the year, because
Mm-hmm.
that one night only gives us that one night. But
Sure,
there's also
sure.
364 other nights in the year that we're seeing. There's also trends of people that are experiencing homelessness more in the winter, or more in the summer, or more in the spring, at the end of school, beginning of school. What are the trends that we're seeing as far as when people, and then also domestic violence, which I mentioned before is a huge contributor to homelessness. When are people actually stepping forward and trying to get out of these dangerous situations? Is there a certain time of year? Is it around the holidays? Do people feel trapped, around the holidays? When is all of this happening, so that we can really get down to the root causes? We can really stop trying to just manage this problem, but we can actually get back to trying to prevent it and end it in the first place.
Yeah, it's a great point. And you mentioned January. I mean, I'm surprised you said it was once a year, just in January.
Just the point in time count is, yeah, it's one day slash night in January.
Because it's cold in January. So I'm curious about, I mean, hypothermia. I would think is a huge problem, but then extreme heat in the summer could be a problem too. So
Right.
lots of drivers for why people
Exactly.
would come into shelter, right? Yeah.
Exactly. And that's kind of why I think it was done originally in the winter, is because people,
Hmm.
it's hard to find people out in the woods sometimes.
Hmm.
So people generally come in to the hypothermia shelters during the winter. We get a better count at that time. But to
Yeah,
your
makes
point,
sense.
the the dead heat of the summer could be the same.
Sure, sure, absolutely. Yeah. Just out of curiosity, do other states have these where they be based on their climate, they would do it at a different time of year to the points we were talking about? Okay,
Nationwide, it's the same day for everybody.
interesting. All right, well, let's move on to the next question. So I think in some ways this one has been answered a little bit just in our general conversation. But how does Shelter House work with other community organizations or government agencies to meet the needs of those experiencing homelessness and domestic violence? And so, maybe you've talked about this a good bit already, but I know there are a plethora of other organizations out there. Do you do a lot of collaborations, partnerships? What does that look like?
Yeah, I like to use the word partnership with a capital P because it's not just about, you and I partnering, right? It's about, we
Sure.
have formal partnerships that we have to end homelessness and domestic violence in our communities. So we certainly partner with other nonprofits. I also mentioned we're all part of the same system, right? So even though Shelter House is
Okay.
one nonprofit doing it, and we have several others doing it within the community, we all work out of the same system. It's a coordinated effort. So we have a coordinated entry system that if somebody becomes homeless in your community, they have to pick up the phone or they have to call, say, go through an assessment through our coordinated entry system. And then that system places them with the right nonprofit where, wherever they're located at the time. And then they place them in the shelter there. So it's already a coordinated effort. It's a true partnership. Faith-based organizations help us tremendously as far as donations, preparing meals at our shelters, doing donation drives. They do not just donation drives for in kind, but also financial contributions. The other unique partnerships that we have, I mentioned about the county government, but also police and sheriff's department. We have formal partnerships with them, especially working with victims of domestic violence. There's a whole protocol in place that when somebody calls the police about a domestic violence situation, the police have their own separate department that responds to that and then contacts us to make sure that they are trauma informed, to make sure that when they are addressing the issue, that they are addressing it from the person that is being harmed, that they're being trauma informed to make sure that they're not causing any more trauma to the situation there in the home. And they also have the resources to reach out to us to place the family directly into the shelter without the individual having to go through a system or any other calls. So it is quite a coordinated effort, both homelessness and domestic violence, with formal partnerships, with formal MOUs to make sure that we're all doing our part, but also can lean on each other when needed.
That's good. I mean, that it really does take the entire community, doesn't it? I had a brush with that years ago, but I ended up I had my two small children. They were babies at the time in the back seat, and I had to pull over the road. I got a call from the state police. I was living in West Virginia, where I said, as I said, I'm originally from there, and they had a lady who was a victim of domestic violence, and she was Peruvian, and she did not speak English very well at the time. So I helped them translate, but I got a real hands-on experience, sad to say, of the fear and the confusion and all that people go through, just the trauma that they're feeling and all. So it's so important to have those coordinated services in the community, and it really does take everybody, just as it did in that particular
Yeah, we
situation.
also serve victims that are fleeing human trafficking and sexual assault also.
Yeah,
So it's not just domestic violence. We kind of wrap everything into domestic violence, but all of these issues are very, very different. As human
sure,
trafficking is one
sure.
that we never see. You cannot walk down the street and say that person is being human trafficked.
Hmm.
It is very prominent here in Northern Virginia. So we work very closely with Homeland Security and the FBI and then the local police departments to make sure that we are addressing that also.
Yeah, I think that one sometimes gets missed in about.
It's people hear about it, but it's again, if you don't see it, you don't realize it's happening, and then there's almost a denial. Well, that wouldn't happen here,
Hmm.
and it's this is not a poverty issue. Human trafficking is not a poverty issue like maybe homelessness is, or even some types of domestic violence. When people entering a shelter, human trafficking is not.
Yeah, it's very. I worked in immigration policy for a number of years, so I can appreciate what you're saying about it's not something you can easily identify just walking down the street, and it is very real concern. Let's talk a little bit about at the state level. So, of course, for you, that's focusing here in Virginia. There's policies like the Virginia Homeless Solutions Program, and the 2024 to 2026 housing action plans. Those I did a little research. It seemed like they were emphasizing rapid rehousing, coordinated entry, and housing focused shelter models. I kind of read that and then I'm like, okay, do I really understand what that means? Could you maybe and help us understand a little bit what those goals are and what that means?
Yeah, and that's really encouraging here for Virginia is, the focus on rapid rehousing and also coordinated entry. I mentioned coordinated entry before, not necessarily again with the small C, but coordinated entry as a actual system that we have of people making sure, when you're experiencing homelessness or anything that you need, you're calling this coordinated entry system and then getting your needs met, and then making sure that the individual is sent to the right resource, whether it be a food bank, whether it be a shelter, or what have you. Rapid rehousing is something that Shelter House really bought into over 10 years ago. And rapid rehousing is what I was mentioning before, is around ending homelessness. The only way that we can end homelessness is by getting people, either preventing people from coming in the shelter in the first place or getting people out of the shelter as quickly as possible. So when we're talking about rapid rehousing, we don't want families or individuals to stay in a shelter until we fix them, until we fix all their issues, and if find them a living wage job, or get all their doctor's appointments out of the way, or get them linked with mental health services. We used to do it that way, and what was happening was people were staying in the shelter for 6, 8, 12 months.
Oh.
A shelter is not a place where people thrive.
Mm-hmm.
We operate 7 of them, and we do a very good job of making sure that they are clean, people are fed, they're comfortable, temperature's right, friendly staff, that it's a place where they feel welcome.
Mm-hmm.
However, they can't thrive in there. Mm-hmm. Children can't thrive in a shelter. Adults can't thrive in a shelter. We need to get them back into housing. So the whole concept around rapid rehousing is if they get into the shelter, or when they get into the shelter, we are putting supports and resources in place to get them into housing immediately. So rapidly getting them in. If we have a housing resource available, we get them in there. Then we can provide some rental assistance to them. Okay. It's also, there's a lot of research that's done that says these shelters that we operate are very expensive.
I'm
it's
sure.
Costing tax dollars and all of that. It's a lot.
Mm-hmm.
Providing somebody with 3 months or 6 months worth of rental assistance versus keeping somebody in a shelter for 9 months is so much cheaper than having that family in the shelter. So that's the concept around rapid rehousing, is the rental assistance. We've been very successful in our communities of getting rental assistance for families experiencing homelessness so that they can end their homelessness within several weeks instead of several months. Getting them into housing, that's where people thrive. The kids can get linked with their home school. They don't have to keep switching schools. The parents can start actually setting up places that they could work that are nearby where they live. They can set up doctor's appointments nearby where they live. Shelter's temporary. You don't know where you're going to end up. Why do you get all of those things set up in a shelter and then have to move several months and you have to reestablish yourself again? So that's the concept around rapid rehousing, is making sure that we know it's housing is the first priority. Mm-hmm. And then we are getting the services in place, and we still have case management available for them to work with the individuals once they're in housing. It's not that we're hands off, but we still are hands on to make sure that they're getting the case management resources to link them with services.
Yeah, that's, I think shelter, I know for me too, you think of housing, because homelessness has the word home in it, and you think about, it's about getting someone a house, but it's helpful to hear you kind of explain, well, there's a process involved, and the shelter is that critical stage, I think, to get them to the next phase, which is what you want is in that house. But thank you so much for what you all do with regard to the shelters. But it makes perfect sense what you're saying, that ultimately rental assistance would be far more cheaper in the, especially in the aggregate, than what you're doing in the shelter, because it's not permanent. And so the goal is, of course, permanence and all, and security. I'm sure COVID presented some real challenges to what you just described. Can you tell us just a little bit about how you had to, we talked about pivoting earlier. What kind of a pivot did you have to go through there?
Yeah, I mean, just like the rest of the world, really had to pivot on no matter
Yes.
what industry you were in, you had to pivot. Well, here we are in a industry that we are in residential facilities, where people are kind of, I don't want to say packed in, they're in there comfortably, but there's a lot of people staying in our
It's
facilities.
close quarters, yeah.
And so, yeah, we really had to pivot there, and we were forced to. I was, if we would have had to plan this years, in years in advance, I don't think it would have happened. It happened because we had to.
Mm-hmm.
So what we had to do is we had to really decompress the shelters. And again, in partnership, this is where policy comes in again.
Figured so.
In partnership with our local governments, the local governments, decompressed the shelters, which meant they had to go out and find other available shelter, quote unquote. So we started working out of hotels, where mostly everybody, or a lot of people, half the people had their own individual rooms, which again, the whole social distancing was a big thing, right?
Sure, yeah, big
And then
challenge.
we were able to decompress the shelters where every other room, every other bed, we could keep people 6 feet apart. So the partnerships with the hotels, partnerships with the local government, then they partner with the nonprofits to actually operate those, what we call COVID relief shelters.
Wow.
Again, federal funds were plentiful at that time. There were a lot of emergency funds to get people rehoused. And I wish I had the number right in front of me, but we were able to rehouse a significant amount of people with those dollars that came into shelter, get them right back into housing. We were able to get people out of the woods and into shelter beds or into the hotels, start working with them, because they were very afraid of their health and very vulnerable, extremely vulnerable. So yeah, we had to pivot in a standpoint where now all of a sudden we have a lot of funding. And now how do we make sure, again, that we're good stewards of that and bulk up our infrastructure to make sure that we can handle these funds too.
Yeah.
You mentioned about one of your other guests talking about nonprofits. One thing that I would really like to add is kind of the misconception of nonprofits. Sometimes nonprofits are charities, yes, and when we talk about charities, we talk about smaller organizations that don't necessarily have, or the perception is they don't have the infrastructure in place like a regular business.
Mm-hmm.
Nonprofits are businesses, and we are operating these just like a normal or a regular for-profit. We have same competitive benefits that we're going after, same competitive talent that we're going after. We have a very robust financial system to make sure that we can keep up with all of this stuff. We have strategic plans to make sure that we are furthering our mission. The only difference between us and a for-profit is we don't bring a profit in. All the profits go right back into the community to make sure that we're serving more people. But for everything else, we still have the same liabilities, and we have to make sure that we have the insurance available to, in case something happens. So running these nonprofits, especially, the size like of Shelter House, we have to make sure that we have the business savvy again, to make sure that we are running these operations effectively, efficiently, and up to standards of all the regulations out there.
That's a really good point you make, Joe, about so the importance of understanding that what nonprofits are, that they are a business. I've worked in the nonprofit sector for the past over 16 years in planned giving, in various areas of development, grant writing in particular, and it is very strategic. It is definitely a business that has an infrastructure, as you said, and strategy is very important internally as well as your public facing plans. And so it is a really important point for people to, I think, come away with is that you're doing the same work that a business would do in order to make things keep going. And it's just a question of where the income is going, which in this case is going to serve the people in the community, which is
Right.
exactly what it's for. I'm going to move on now to federal policy. We know that and I'll just say in general terms, there's been a lot of flux. It's some uncertainty out there, a lot of change. And so I'll start with just a tiny bit of history, and I don't want to run us over too long here. But so just for our audience at the national level, I did a little research and learned a little bit more about the Emergency Solutions Grants Program. And my understanding is it's a federal assistance policy specifically intended to address the challenges of homelessness. It is administered through the U.S. Department of Housing and Urban Development, so HUD for short, is maybe recognizable to a lot of people. The policy framework for this program was established when the Homeless Emergency Assistance and Rapid Transition to Housing, that's a mouthful, HARTH, I guess for short, Act of 2009 amended the earlier McKinney-Vento Homeless Assistance Act. So a lot of acronyms in there, a lot of big, long titles of programs. But in general, what is the current status of the history of these programs, and what are some of the services they provide to those like organizations like Shelter House?
Yeah, so all of these federal fundings are extremely important to us, and
Okay.
this is what's really helped us to build what we have today with these robust systems to make sure that we're ending homelessness in our communities. So ESG is one of them. We have several other grants that actually I talked about local funding before, and our local governments also apply for these federal funds, right? So just because they're local dollars doesn't mean it's all coming from taxpayer dollars. These are actually grants that are pass through grants from the federal government. So all of this is impacting us. The interesting thing, and you talked about pivoting, you talked about keeping our eyes out on different policies from the federal standpoint. Things are changing right now, and they change with every administration. Doesn't matter what administration it is. Doesn't matter if it goes from Democrat to Democrat or Republican to Republican, or it switches sides. We always have to make sure that we are on top of what the priorities of the administration is. So as you mentioned, things are changing fairly quickly right now. And HUD is one of those departments that is making changes. We talked about rapid rehousing earlier, and one of the policies around rapid rehousing and the dollars that we're going into rapid rehousing. And this current administration, along with HUD, is shifting gears away from rapid rehousing, permanent housing, and more towards a transitional housing model. Transitional housing models are models that we used to use, and they have mandatory services in place. And we have found, and they're also, I don't want to say time limited, everything's time limited, but they're like 2-year programs with mandatory services. And then people have to move after that, after the 2 years. What we have found is that we can serve people at a shorter amount of time with rapid rehousing dollars when they're in their own housing and they don't have to move afterward, and it's cheaper that way. But again, just going back to what you were saying, kind of at these, yes, we were talking about local policy and how important that is. Federal policies are just as important, because like this shift right now, it's making us now look at what models we are using and how we can shift the work that we have been doing over to a different method, different model, and still help the same amount of people. So again, we are still at kind of the liberty of the politics of this. No matter what we are doing, we have to make sure that we're keeping an eye on and make sure that we're complying with it also. We want to make sure that we are not losing any funding for people experiencing homelessness. We will shift what we need to shift. We will do what we need to do in order to serve those people who aren't housed right now.
So by traditional, you said that was a model that was used in the past. I take it that from what you said, it sounds like that probably wasn't. Would you say that was less effective than what you're doing now, and that what will be the challenge for you if that's the case, to try to find some kind of common ground, some kind of middle ground for that?
Yeah, exactly. I certainly am not going to. I think there are benefits to every housing solution. Transitional housing is certainly a housing solution that can benefit people experiencing homelessness. Okay. What we need to figure out, and this is very challenging. I was once told that every easy problem has been solved. Homelessness is a very complex issue.
Yeah.
Homelessness has not been solved. So what we need are housing solutions, a variety of housing solutions for the different contributing factors to homelessness. We can't have a one size fit all. We can't just have housing first and rapid rehousing dollars. We can't just have prevention because not everyone can be prevented from becoming homeless in the first place. People are going to fall into homelessness, unfortunately. We also can't just have transitional housing where we fit everyone into a transitional housing box and expect them to thrive. We also need alcohol and drug services and, different services, or we operate permanent supportive housing. Permanent supportive housing is a very long-term housing solution for people that have some type of disability, whether it be a mental disability, a physical disability, that they're not able to work. A transitional housing model wouldn't work for them. A rapid rehousing model wouldn't work for them. We need permanent supportive housing for these individuals to get back on their feet. So it is a complex issue. There are a lot of different reasons that people become homeless in the first place. And we as a nation really have to start to understand what are the contributing factors and what's the end game. Let's not focus on getting them into our system. Let's focus on getting them out of our system. And the only way we can do that is identify what housing solutions are the best for the issues that we're seeing.
Yeah. Yeah. You mentioned the word, which I think is very appropriate before, we want people to thrive, not just survive. So, yeah, for sure. So I'll pivot. I'd like to pivot just a little bit, and I'm cognizant of our time here. But growing up, the public perception of homelessness had a lot of stigma attached to it. How do we as a society overcome that? It's a big, broad question, I know, but in yours and your team's significant experience, what do you believe is most misunderstood about homelessness?
Yeah. I'm going to use me as an example. As I mentioned, growing up, I didn't know anything about homelessness. I mean, people were homeless, and I saw pictures of people that were homeless, and I took a field trip to the DC Zoo, and I saw people sleeping on park benches. I came from like I said, it was a privileged background that I was brought up in. Still very middle class, but I wasn't exposed to any of this. And it wasn't until I got my first job at a shelter that I really started to understand why people become homeless in the first place. I had, in my first 3 months there, I had a gentleman come into my shelter or into the shelter and sit down with me, and I was doing his intake, and I was going over his work history, and he had a PhD. And I looked at him and what are you doing here? And he was an alcoholic. I knew nothing about alcoholism. I just knew that, hey, people get drunk and screw up and they become homeless. Now they're bums. That's how I used to think. Mm-hmm. The perception is real. You're absolutely right.
It's a disease, yeah.
What we need to do is we need to make sure that we start to understand people. Mm-hmm. Let's not start talking about issues. Let's start talking about the individuals. Let's get them in front of us. So many policymakers, getting back to that, are making policies without the voices of the people that it's actually affecting. Yeah. They know it better. They know what they're going through.
Yeah. Yeah.
It's not us. I'm listening to them. I'm advocating on their behalf, not my beliefs, because I was brought up in a completely different belief system. Trust me. And if I wasn't listening to the people that are just surviving and are coming to us needing help, I would have a different set of policies too. And I think that's the biggest thing that we need to get across, are the policymaker and decision makers that are in these rooms need to make sure that they are hearing and listening to and following what the people who need the service actually want.
Mm-hmm. And their story is so important, and to hear, to actually listen to them. Yeah, I couldn't agree more. Sometimes even the best intentions are still about talking about people instead of just listening to them. So yeah, absolutely. So we've already talked a lot about ways that at every level of governance we can better support organizations like Shelter House and the many coordinated systems that you talked about earlier. I feel like we've covered that pretty well. So I'll just kind of open it up at this point and ask you, Joe, if there was maybe this is an unfair question to ask you for one thing, so feel free to expand, but if there was any message that you would like for policymakers to really hear at any level, that would help your cause, that would help the capacity for you to serve the residents of Loudoun and Fairfax better, who are at risk or maybe already experiencing homelessness, what would that be? What would you like for them most to know?
Come to our shelters, see it, hear the people that are in the shelters right now.
I want to do that
Talk
too.
to them.
Yeah, I do. I do. Because I think that, don't you think that residents as well, I mean, people who live as neighbors technically for these folks too. But yes,
Yes.
policymakers.
Yeah, and you mentioned it as far as it's changing the perception. It's not just changing the perception of our community members, right?
Mm,
It's changing the perception of our policymakers.
right.
That's what I think we really need, is that change of making sure that they are carrying the stories that people have,
Hmm.
and that they're just not making these random policies based on their beliefs. And the only way that you can do that is come to us. Come to us, talk to the people that we're serving, talk to people that were formerly homeless, that are survivors of domestic violence. What worked for you? And it's not just going to be one answer. There's going to be 1,000 different answers. And we need to make sure that we're taking those answers and we're doing the best job that we possibly can to end homelessness across our country. Because, as I mentioned, it can be done. We can end homelessness in our country. It's if we want to, and what are the policies in place to make sure that we do that.
Excellent. I hope that plenty of policymakers will, at all levels, will come and visit you, and that they will accept your invitation. And certainly, I'm happy to try to help get the word out and do
Please.
my part with that as well. So that's a great place for us to wrap up. This is a complex problem, as we've said many times during this episode, and I know we could talk about it for a long time, but I know you have actual work on the ground to do, so there's a balance to be struck there, and I want to respect your time with that. So, folks, we've essentially come to the end of our time on this episode. Joe, again, want to thank you just so much for your time today, for being a guest on the show, enlightening us to the many complexities of this and this challenge that we have to serve our neighbors, many of whom live right within our midst, but still are invisible, and we want to fix that. I know that you and your team at Shelter House devote countless hours and energy to serving our most vulnerable neighbors. How can people listening to the show support Shelter House today?
Yeah, there's a lot of different ways. In our website, shelterhouse.org, you can go there, get involved. There's ways that you can donate financially. We always start with that. Any type of resources that we get to operate our programs, to make sure that people, we have flexible funding. I mentioned before about a lot of the contracts and grants that we get. There's a lot of stipulations about what we can spend that on. So donations, from private donations, from individuals, from corporations, from businesses, that's flexible funding that we can use to make sure that those really difficult situations that these grants don't cover, we can get people back into housing with that. In-kind donations, people are in need of a lot of different things, and we have a lot of different ways to donate in kind on our website through the Get Involved button, and then just getting the word out. If you know somebody that is experiencing homelessness, have them contact us. And certainly, if you know or think that somebody is experiencing domestic violence that you know of, have them reach out to us. Or even better, sometimes that person that is thinking or just needs guidance on how to deal with a situation of somebody that's experiencing domestic violence, that's what we're here for too. We are not just a service provider answering the phone calls and inviting people in the doors that are experiencing these issues, but we want to educate the people also that are seeing what's going on out there, so that you're better positioned to address these too. So there's a lot of different ways to get in touch with Shelter House. Come take a tour of one of our shelters. We're in Loudoun, we're in Fairfax. We have a lot of different shelters that you can come tour. And that's the best way to get in there and see exactly what we're doing and to see how you can help.
Thank you, Joe. Ladies and gentlemen, you have an open invitation from Joe and Shelter House. Please take advantage of it and go see for yourself. Personal experience is probably the best way to fully understand what people are experiencing when they're experiencing homelessness. I want to wish you, Joe, your family, everyone at Shelter House, the happiest of holidays. And to our listeners and viewers, happy holidays and a happy new year. Have a prosperous and healthy 2026. Thank you so much again, Joe. And I wish you
Thank
all
you.
the best.
Thank you.
Take care.